and the
la Cámara de
Longmont
Comercio de
Sustainable
Latinos
Business
de
Program.
Puebla.
Thank you all so much for your partnership. And I'll kick it back to Terry.
Excellent. Thank you again. My name is Terry Heyman, and I work with the Family Resource Center Association.
Trabajo con el Centro Familiar.
And I'm acting as your MC or moderator today. So we do have, as Deborah mentioned, a great set of
Como Deborah
panelists.
mencionó, tenemos muchos panelistas.
And then also we want to just talk about what we hope to gain today in our time together. From allowing flexibility with work schedules,
De permitir flexibilidad
and making it easier for mothers to pump at work, and connecting employees with community resources. There are many things employees do to support employees and create that have caretaking responsibilities. So we're excited that you joined us today to hear how businesses are taking action, what resources are available, and shared successes and lessons learned from others in this field. So I'll go ahead and have the panelists unmute themselves and briefly introduce themselves and their agency, and then we'll get into the content. Welcome, Lilia.
Hello, everybody. My name is Lilia Chavez. Thank you so much for having me here today to talk a little bit about food security. I'm a food security specialist for Tri-County Health Department.
Thank you, Lilia. And next, Mandy.
Hi, everyone. My name is Mandy Feeks. I'm the breastfeeding program specialist at Denver Public Health. It seems my internet bandwidth is low, so I'm going to leave my video off, but it's nice to meet everyone.
Great. Thank you, Mandy. And Michelle?
Yes, good morning. Thanks for having me. I work with Tri-County Health Department, and my role involves connecting businesses with wellness resources for their staff.
Thank you, Michelle. And then Nicole?
Hi, good morning. My name is Nicole Reel. I'm president and CEO of Executives Partnering to Invest in Children, otherwise known as EPIC. And we have a membership of business executives who work to support family-friendly environments and early childhood policies to support our current workforce and developing a great future workforce as well.
Thank you. And lastly, Kelly?
Hi, everyone. Thanks for having me. My name is Kelly Steinbeck-Tracy, and I'm a perinatal mental health specialist for the Maternal Child Health Program at Denver Public Health, and I'll be talking to you today about parental mental health.
Great, thank you. And we're going to pause for just a moment while we figure out the interpretation. So just give us 1 minute of technical time, and then we'll launch right into the presentations. Lily, if you wanted to go ahead and pull up your PowerPoint while we wait, that would be great. Thank you. And then Deborah, if you'll just let us know when we've got Jen as an interpreter, that would be great. And then we'll launch into Lilia's presentation.
Jen, I'm showing you as an interpreter.
So when I'm speaking to you in Spanish, you can hear me, correct? You cannot hear me.
Let's see. Okay, I'm going to switch to Spanish.
Okay, in Spanish, you should be able to hear me. So are you able to hear me in Spanish?
Yes, I can hear you in English.
Well, yeah, I'm speaking to you in English, but you're able to hear me on the Spanish channel.
Yes, yes, ma'am.
But my understanding is that when I'm speaking in Spanish, that the rest of the participants in English that are on the English channel are still able to hear my interpretation.
Let's try. I'm going to go off and see if that's still the case.
Okay.
Say something.
Okay, just wanted to check and see if you're able to hear me in Spanish at all, or on the Spanish channel at all. If you're not, then I'll continue. Okay, you're good?
I can hear you. We can hear you.
Okay. Okay, it's just that I haven't been selected as the interpreter, but I'm assuming that it should roll just fine if you're not able to hear me in Spanish.
More. Okay. Okay, let's try this. I'm going to make you change role to attendee, and then I'm gonna, or change.
When you had me as host before, I was able to just promote
Okay.
myself.
Let's see if you can do it now.
Okay.
Thank you, everybody, for your patience as we figure this out.
When Lily's sharing her screen, I think I'm having difficulty doing it. English language interpretation, maybe. No, here we go. Add interpreter. Jen. English 2. Spanish.
Isn't it funny how no matter how much rehearsal you do, you can still get some curveballs when you go live. So again, everyone, just really appreciate your patience as we figure out how to do this right. Okay, I think we're...
Excellent. Thank you, Jen. All right, Lilia, do you want to try and share your screen again? And then we'll have you go ahead and start your presentation.
All right, well, thank you again, everybody, for having me here today. Like I said, my name is Lily. I'm a food security specialist for Tri-County. And today I'm going to be talking a little bit about food assistance and resources for programs that can help families put food on the table. All right, so why am I talking about this? And why is food assistance so important? So right now we're seeing an increase in unemployment and poverty rates in Colorado. Right now they're reporting 29% of Coloradans report hunger, and this is a rate that has tripled since the start of COVID-19. So the reason why I talk about this so much is because a lot of residents don't know about food and nutrition resources that are available to them since they've never had to access them before. So this is where employers could help. So I'm briefly going to be talking about a little bit about the benefits, but I want you to know that some of these really depend on each family. And so at the end of this, I will talk about one big thing, one big takeaway. So one of the first programs that I always talk about is SNAP, because it is food and money that could be given to families so that they could purchase food. So the benefit amount really depends on the family size and income. U.S. citizens and some legal permanent residents are eligible, and there's different ways to apply via paper, online, and phone. And I will go over a little bit more about this in a little later. Another program that I really like to talk about is WIC. So WIC is meant for families that are pregnant women, postpartum women, and kids up to age of 5. So if a family has one of these, they may be eligible for WIC. It does require ID, proof of address, and family income. If a family already has SNAP and Medicaid, they automatically qualify for this program. And there's places, again, to apply. But if there's one big thing that I could give you today in these 5 minutes, it would be just this resource right here, Hunger Free Colorado. So Hunger Free Colorado is a one-stop resource for local and federal nutrition assistance. So this is a statewide phone call or line that families could call, and they can explain their family size, they can explain the composition of their family, and then they would be able to get the assistance that they need. So Hunger Free Colorado can help them apply for SNAP, can help them apply for WIC, and can connect them to local food pantries. We understand that sometimes it's a little bit harder for families to talk to somebody, and so they do have an online version of this as well. So if you go to their Hunger Free page, you can see their online map. And families would be able to check what kind of program they are interested in, what days they're open, if it's morning, afternoon, evening. And then all of this with Hunger Free, it's free, it's bilingual, and it's confidential. And so again, here's the free resource hotline. And then the hotline is open Monday through Friday, but obviously the online map can show you a little bit different hours. So I know I had only like 5 minutes. So again, if I could give you one big thing about this is make sure that you give this to families, because again, this is just a one-stop resource. I kind of just jumped briefly into that, and I think we're gonna have questions at the end. Is that correct?
Yes, that's right, Lilia. Thank you.
Okay, perfect. So yeah, that is it for me. So thank you so much again.
Great.
Stop sharing.
So one excellent resource that you all as employers can do is maybe navigate to Hunger Free Colorado and pull the hotline, some graphics off of there. I know that Hunger Free Colorado also has great social media versions of that. So if that's something you wanted to add to your, internal employee communications, like a newsletter you might be doing, or add it to your website so that employees know that that resource is available. Thank you, Lilia. And up next, we're going to hear from Mandy about breastfeeding program and how to create more breastfeeding friendly environments in work. Go ahead, Mandy.
Great. You can see my screen?
Yes.
Perfect. So hi, everyone. My name is Mandy again, and today I am here on behalf of the Advancing Breastfeeding in Colorado Coalition, which strives to help businesses support nursing mothers that are returning to work. So to start, I just want to give a brief explanation of what ABC is. Of course, it stands for Advancing Breastfeeding in Colorado, and this is a regional project that's funded through the Cancer, Cardiovascular, and Chronic Pulmonary Disease Grants Program. So our partnership includes not only Denver Public Health, where I am housed, but also Boulder County, Jefferson County, Tri-County Health Department, the Colorado Health Institute, and then we have a non-metro coordinator available to help expand our reach to be statewide. Now, the primary goal of ABC is really to improve health and reduce disparities across the state by creating a more seamless system of breastfeeding support for parents and families. So we know that breastfeeding provides numerous health benefits, and it's the healthiest option for mom and baby. However, breastfeeding families face a number of different obstacles that really make a difference in how long infants are breastfed. So it takes that supportive community and a supportive environment to help breastfeeding families to be successful. And that's why ABC formed, and we partner with businesses like all of you, as well as public spaces, medical offices, and childcare. So why are we promoting breastfeeding? I know we're limited on time, so I won't spend much time here, but you can see up on the screen that there are a number of different benefits to breastfeeding. It improves health for both mom and baby by reducing the risk of cancer, heart disease, respiratory infections, and many other things. And the American Academy of Pediatrics actually recommends that babies receive only breast milk for the first 6 months of life. So in Colorado, we've actually found that moms want to breastfeed. Nearly 90% start out breastfeeding, or they at least initiate and show an intent to do so. But you can see on the screen up here that breastfeeding rates begin to drop off over time. So only about 25% are exclusively breastfeeding for that first 6 months of life, and only about 41% are breastfeeding in any capacity for that first year. So of course, the question becomes, why do families stop? And there are many different barriers for breastfeeding families, whether it be lack of knowledge, lack of support, healthcare practices, or even cultural norms. And returning to work has been cited as one of the top reasons that breastfeeding families discontinue. So it's important to improve breastfeeding rates in Colorado by making sure that families are supported in their place of work. So let's talk about the role of the business, because that's why you're all here, right? So evidence has shown us that breastfeeding moms are a lot more likely to be successful in meeting their breastfeeding goals if they're supported in their workplace. Many families are returning to work within 4 to 6 weeks of giving birth, sometimes even sooner. And those that return to work the soonest are typically lower income or hourly wage workers that are even less likely to have lactation accommodations and support in place. So not only is it important to us as the ABC group to help educate employers about what you can do to improve your work environment, but it's also the law. So in Colorado, the law states that employers are required to provide time in a private space that is not a bathroom, where a person can pump and store their milk throughout the day for up to 2 years after birth. So you'll notice that the Colorado law is actually even stronger than the federal law is. The break time can be unpaid, or a mom could use her paid breaks or her lunch hour. That just needs to be agreed upon between the employee and the supervisor, which also helps to establish those open lines of communication. Yet, unfortunately, a lot of women are not aware of their breastfeeding rights in the workplace. So our grant is in place to collaborate directly with business partners to help all of you make positive changes to your workplace. And once those changes have been made, we can actually provide certification as a breastfeeding friendly business. So companies that have lactation support programs in place see a lot of positive outcomes. Employees are more productive and loyal to their company. They often work later into pregnancy, return to work sooner, or work more on their own time. And of course, mom and baby are both healthier, which results in less sick calls and savings on healthcare costs. So through ABC, there are staff available at each local public health agency to partner with all of you to ensure that there are policies in place that support employees and help provide time and space to express milk. This is just a snapshot of our assessment tool. So we actually take some time to understand where you're currently at, where improvements can be made. I'm not sure how well you can see this on the screen, but there'll be a follow-up email. In order to be certified as breastfeeding friendly, you just have to fall into the yellow or the green boxes on that assessment. We can also provide technical assistance, and we have some limited funding to help develop lactation spaces. So these are just some examples you can see on the screen here. Employers all over the country have gotten really creative when it comes to developing lactation spaces. You know, it doesn't necessarily have to be a permanent structure or a traditional room with 4 walls and a door. This is something that we can absolutely help identify in your space as well. So that's all I have for you today. As I mentioned, Deborah will be sending out some follow-ups, which includes contact information for all of the local public health agencies, as well as our Colorado Employer Toolkit that walks through our breastfeeding friendly certification process in a little bit more detail. So we hope to hear from all of you and work with you on becoming breastfeeding friendly. Thanks so much for your time.
Thank you, Mandy. There's 2 great questions in the Q&A. So if you want to review those while the other panelists present, so when we circle back, we're prepared to answer that. Thank you so much. It's so great to see that there's that work site assessment. So if you're interested in thinking about where your employee, where you currently are and what you need to do to get to that breastfeeding certification, that assessment seems like a really great resource. Awesome. So now we'll go to Michelle to hear more about initiatives for workplace health and healthy staffing project.
Yes, hi, thank you. Can you see my slides okay?
We sure can, and we can also hear you great.
Great. Okay, thanks for having me. I actually work with Mandy. We are one of the 4 local health departments involved with the regional grant for supporting breastfeeding in workplaces, childcare centers, and medical offices. So Jefferson County, Mandy and Denver and Boulder and Tri-County, we can support that. In addition, Tri-County has been doing some other programs to support our local businesses. And I'm just going to share with you the 3 different things that we've been up to. The first 2 you see here are both were in response to COVID-19. So they are part of our emergency response. The third thing is an ongoing project we've had since 2015. So I'll just go into each of them briefly. The Business Reopening Task Force, that was created a few weeks after the governor's first orders in late March for stay-at-home orders. We were getting an influx of calls from businesses seeking guidance on how to interpret the governor's orders and the public health guidance. So we established a team of 4 people to handle the phone lines and email. So it's a dedicated email and phone line, and we still have that. So that is available. That's the second thing here under individual support. We've got a email and a phone number for you. In addition, they do weekly Q&A webinars to help businesses navigate the guidelines. We have one tomorrow at 10 a.m. and these are translated. And we also frequently have during the week for Spanish-speaking business owners. We have worked with our partners up in Adams County to provide those opportunities to ask about questions in the public health orders as well. So that's the first thing we have going on. The second thing is the Healthy Staffing Project, and that really came out of seeing a greater need for support during the COVID-19 response. And so this project was created. We were able to use CARE dollars for this. It was launched by Jennifer Tellis in September, and it includes getting cloth face masks with your company's logo on them, assistance coordinating and promoting flu shots to your workforce, free video training and employee workbook on managing challenges with customers, and a lot of different promotional materials, including a healthy staffing certificate and window clings to show your customers that you are responsible and taking this seriously and want to keep them and your staff safe. So that is the link there will get you to all of that information. The third project, as I mentioned, has been ongoing. We established this in 2015 through a grant from the State Health Department. And basically what it involves is 4 employer, we call them coalitions. They're basically support groups. We convene each of these groups typically monthly, and we provide them with the opportunity to share ideas for supporting employee health and wellness and safety. And we provide them with training as well, and resources and tools and assessments. We actually use the originally created by Epic, the family-friendly assessment tool through Healthlinks. That's one of the assessment tools that our employers can use. And the Healthlinks general assessment tool, we cover the cost of both of those for our participating employers so that they can get a baseline of where they are. And then we help guide them through the process of becoming a certified healthy business. And that is now a national certification through Healthlinks. So we have a lot of different things going on for employers. We work with our local partners. American Heart Association has a annual workplace health symposium, and we provide tickets for our participating employers to attend that. And we have funding opportunities both to support an employer's breastfeeding friendly efforts and other family friendly efforts and policies, and any kind of initiative that an employer wants to put into place to support the health and well-being of their staff. And the main thing that participating employers cite as the most valuable aspect of this initiative is the peer support, mentoring, and sharing ideas. And oh, there is one more thing, sorry. We're about to launch a pilot, similar model, a coalition, and it's going to be helping employers, a group of employers, work through the steps involved in either improving or adopting diversity, equity, and inclusion program for their organization. So if you're interested in that, I'll put my email in the chat. So that's all. Thank you.
Thank you so much, Michelle. Really relevant, your first piece that you talked about as we anticipate some new guidance coming out and how your business can either reopen or keep your employees safe through this time. So thanks, Michelle. And there's nothing better than peer support, right? It's great to learn from another business leader that's already gone through the trials and errors. So appreciate that. And up next, we'll hear from Nicole. And really start to talk about what is the data telling us about these different employee strategies. Nicole?
Great, can you hear me okay?
We sure can, and we can see your slides.
All right, sounds good. Well, awesome. Good morning, everyone. I'm Nicole, and Executives Partnering to Invest in Children, as you heard earlier, does have an employer toolkit we've developed in the past, as well as a family-friendly assessment. And we work really closely with our members and other employers across Colorado to really support working families and make sure that we're making Colorado a great place to raise a family. And this is an area where we can continue to recruit and retain a fantastic workforce here in Colorado. So a couple things to note. Oops, there we go. So first off, why does this matter? A lot of this data is from Early Milestones Colorado, but I wanted to share typically about 1/3 of our workforce needs childcare at any given time. So I'm really going to focus today on childcare needs and working families. We know that with the pandemic, this has certainly emerged as, I think, a very high area of focus for employers right now. So about 1/3 of our workforce has children that are under age 12 and need childcare on a regular basis. Right now, a lot of the emerging data tells us that about 35% of families do not have the infant care they need, and about 40% of families do not have school-age childcare that they need. So this is a huge impact on families right now with regards to the pandemic, with many schools and childcare programs closed, reduced capacity, or families just really keeping their children at home for fear of them contracting the COVID virus. We also right now know that we have at least 11% of our childcare facilities closed in Colorado. Unfortunately, most of those have likely closed permanently, and we unfortunately also expect that number to increase. State partners are estimating that we may lose upwards of 15 to 20% of our childcare businesses as a result of this pandemic and the financial stresses that have come onto those businesses. And as you can see too, we also see that many of them are struggling with reduced enrollment, the need to purchase more PPE for their businesses, and that many of those workers have also been furloughed within the industry. It's also important to note that since February, we have seen 42,000 women with children leave the workforce since February here in Colorado. And just to give you an idea, we've seen 40,000 women without children enter the workforce since February. So that's a very stark contrast, unfortunately, that we see with the data right now and impacts on women. So first off, what can employers do to support working families? The first area is really accommodating working families. And these are some of the easiest and I think most simple things that employers can do. Of course, schedule flexibility and allowing employers to break up their work hours and get their work done at different times that might work well for them. I'm a working mother with a first grader who's actually quarantined and learning from home right now. So I'm speaking about this from firsthand experience that I sometimes am emailing at 10 o'clock at night or am sometimes up at 6 a.m. working on work projects so that I can juggle my daughter's learning schedule and help support her. Of course, remote work arrangements are going to also be important to the extent that employers can offer that. And really open conversations and a supportive culture. So having the company's leadership really model and normalize working families from home, the more they can see top level managers or leaders really, having their children in Zoom calls or really calling it out as something that is important to the company's culture and policies and practices to support working families and to really normalize those changes that have been made are going to be really important. And really predictability and communication. So to the extent you can make meetings predictable for employees, communicate things far ahead of time so that they can plan on those things. If they're trying to balance scheduling at home with a partner or trying to manage a child's learning schedule, of course, they're also trying to plan around those things, and that's going to be really helpful for them. So predictability and flexibility are key here. Although they seem to be in conflict with each other, they actually make a lot of sense for supporting working families. Paid leave, if you can offer it. We know that companies are all in different places right now financially, so some can and some can't. But we know that a lot of families right now both have elder adults in their lives that they may be caring for and checking up on, as well as younger children they're caring for. So, definitely important to include that if you can. And we also know that a lot of businesses right now have really stepped up to provide technology and or tutoring supports for families who have children who are learning remotely. A lot of families don't have an extra laptop on hand or don't have the money to purchase that. And so we've seen some companies here actually provide end-of-life laptops or extra laptops or devices they have in their offices and have provided those to their employees so they can use those for their children's learning at home. We've also seen some companies really step up and help with providing stipends or providing better access to internet access for families and higher bandwidth as well, since oftentimes Zoom calls and e-learning also take those things up. Couple of other areas to think about. Again, this is limited based on some companies and where they're at financially as a result of this pandemic, but we've also seen some companies provide backup care and solutions that help their employees find childcare. Those are definitely out there, and Epic helps a lot of our members and partners find those solutions, whatever works best for them. Of course, there are stipends and dependent care savings accounts that can also be used. Larger companies like Deloitte, for example, have started to provide their employees with a stipend to support the cost of childcare, whatever that is. If it's paying maybe a family friend or neighbor to help care for the child or a licensed childcare setting. We've also seen companies develop co-op models or contract with partners like the Boys and Girls Clubs to provide virtual learning or kind of co-opt childcare sites. And of course, we also have companies that have been donating to projects like Keep the Lights On Fund, which is a sustainability grant fund for the childcare businesses themselves to help keep these businesses in our communities open. So even if you're a company that really can't provide that on-site option or invest in something for your employees, contributing to the Keep the Lights On Fund will help provide sustainability for the industry itself. And just to note that there are a number of Colorado and federal tax credits available to help support employers with this as well. And lastly is just encouraging all of our employers to advocate on behalf of working families and family-friendly policies that do support these things. So to date, there has been a $3 billion child care investment for the entire country. That's about equivalent to what Delta Airlines got in the first CARES package. So although it seems like a lot of money, it's actually not that much money to support an entire industry across the country. Of course, we're hoping that the federal Congress and partners will pass another package and will provide substantially more support for this industry. We ask that when you're speaking with legislators or if you're getting involved in those conversations that you are advocating for stimulus relief for the childcare industry to support working families, and that you're also just supporting those opportunities across the board when those come up. And of course, you can engage with organizations like EPIC and Good Business Colorado, who are definitely having these conversations on a regular basis. So we'll answer questions later, but that's all I have for you now.
Thank you so much, Nicole. Offering some ways for businesses to accommodate, invest, and advocate in those childcare options for their employees. And then lastly, we have Kelly, who's going to be talking with us about some additional data, but more towards perinatal mental health.
Great, thanks for having me. Can you hear me okay?
We can, yes.
Great, and I'm figuring out how to start my video while I share my screen. So I really appreciate the opportunity to be here today to talk about how employers can support parental mental health. Although the bulk of the data that I'm going to present today is about mothers, I want everyone to know that this issue can impact any member of an expecting or new family. Let's see. Oh, sorry. Let's see. There we go. First of all, it's important to know that parental mental health concerns are very common. 1 in 7 mothers and 1 in 10 fathers experience depression during pregnancy and postpartum. Mental health challenges can begin anytime during pregnancy or the first year of parenting, including after a pregnancy loss. Adoptive families can also experience mental health concerns. And in Colorado, suicide and drug overdose are the leading causes of maternal death. So clearly, this is an issue that is costly to our society on many levels. Looked at from a financial perspective, perinatal mood disorders cost Colorado $199 million in 2017. The largest cost driver is reduced economic productivity among affected mothers. We also know that about half of perinatal women with a diagnosis of depression do not get the treatment that they need. So now I'm going to provide some data on maternal mental health, access to mental health services, and paid family leave. This data is collected and analyzed by the Colorado Department of Public Health and Environment using an innovative survey called Healthy Moms. So Healthy Moms is an online longitudinal surveillance sample of all live births in Colorado. The mothers complete 6 online surveys starting at 3 to 4 months and going through their child's third birthday. The survey asks mothers about their employment status and their access to paid family leave, among a lot of other things. It also asks about their mental health status and includes 3 questions that, when combined, serve as a screener for anxiety. The data I'm reporting on today was collected from mothers who had their babies in 2018, and we are so happy to be able to lift up the voices of these moms who take the time to fill out this survey. So let's look first at work status. In Colorado in 2018, 69% of mothers worked during their pregnancy. Of these, 6 in 10 had returned to work by the time they took the 3 to 4 month survey after birth. Another 2 out of 10 were planning to return to work. When we look to see who used paid family leave, 53% of employed mothers had access to and utilized this benefit. Ironically, paid leave was used the most by mothers who reported that they have some money left over at the end of the month. The least likely to use paid leave were those who reported that they do not have enough to make ends meet. We're hopeful that the passage of Proposition 118 will address the inequities related to those who had access and utilized paid family leave. Now, looking at mental health data, we see that 30% of mothers had an elevated score on the anxiety screener at 3 to 4 months postpartum. The graph on the right shows that the women with the least economic security were the most likely to have an elevated anxiety score. When we look at the relationship between paid family leave and anxiety scores, we see there is a significant difference. 26% of women who use paid family leave had an elevated score, compared with 33%, or 1 out of 3, who did not use paid family leave. When we look at women who indicated that they wanted or needed mental health care counseling services, we see that 38% of women overall and 65% who had an elevated anxiety score indicated that they needed or wanted these services. We also note that 25% of the women who took this survey who did not have elevated scores also said that they wanted these services. Yet, only 62% of the women indicated that they were able to get the mental health support that they wanted. This means that nearly 4 in 10 women did not receive the mental health services that they indicated they would have liked to have had. When we look at barriers to mental health services, we see several things that employees are well positioned to address, including concerns about the costs of mental health care, worrying about time off work, and concerns that someone would find out that they needed help. In maternal child health, we recognize that we all have a role to play to make sure that families have the supports that they need to thrive. In supporting parental mental health, employers have a big role to play. We know that taking paid family leave protects against mental health concerns, and this is true for pregnant people as well as for their partners. Even with paid family leave legislation, we know that organizational culture that promotes the use of paid leave is important to assure the utilization of the paid family leave benefit. Employers can reduce barriers to accessing mental health care by assuring that mental health is a covered benefit in the health benefits that they offer, if they're able to offer them. They can also discuss mental health and actively promote the use of mental health services and supports within their workplace. And finally, they can use materials to raise awareness about maternal mental health. We have some materials specific to parental mental health that can help support these discussions. Here are some examples of some materials that we have that are available to start conversations about parental mental health. The materials are for mothers and also for their support partners. They help mothers and partners who are struggling to know that they are not alone, and they encourage help-seeking behavior. They have a phone number and a website where mothers and their support partners can reach out to for support. The materials are available in both English and Spanish and include parental materials, as well as copy and paste ready social media posts, and also language that can be used in employer newsletters. You're welcome to reach out to me for more information about this resource. And here's my contact information, and I look forward to hearing from you. Thanks so much for having me.
Thank you, Kelly. I think it's a great, piece that you can play as a business is really around that stigma of making sure that everyone's mental health is addressed, but specifically those parents that are expecting or newly parents. So thanks, Kelly. Well, now's the time in the program when we're going to open it up for question and answer. I know we had a couple that were typed in. Mandy, do you want to circle back and see if you have a response for those questions?
Yeah, I'd be happy to. I'm going to try my video again. My internet connection seems to be a little bit more stable. So the question was, what are some ways that outdoor and trade companies such as construction, landscaping, parks departments can provide safe private breastfeeding locations when there's not an indoor space readily available? So I'm actually going to pull up my screen again because I think it's helpful to have a visual. And you can see in the bottom right corner here that there are some different flexible mobile spaces like pop-up tents or portable shelves that look a little bit like restrooms, but of course the toilet would be taken out so that it's a comfortable space for women. I will send a link in the chat box to some video examples of successful stories in outdoor spaces. You know, if it's not possible to have a mobile pop-up tent like this, we have seen employers provide like windshield visors and allow the use of like a company van or their mobile vehicle if needed. So certainly can get creative. It may not necessarily be ideal, but it's definitely providing something to support those employees. So that's such a great question.
Thanks. And I think the follow-on was, in addition to that space of how to safely store the breast milk that would have been pumped. Do you have any suggestions there?
Yes. Sorry, I totally missed that. I would just recommend a cooler, and the employee could provide or bring their own cooler, or if the employer is able to provide that as well, keeping it in a shaded location with some ice in it, of course.
Excellent. Thank you. Other questions from our attendees, and feel free to, you can use the question and answer if you want to chat in, and I believe there might be a way for us to unmute you if you wanted to ask your question verbally. Well, while we wait for a question, maybe panelists, if we'll go through one of the questions we prepared, we'll just kind of go in the order that you presented if you wanted to answer. What would you offer as the first step that our audience might take towards increasing their family friendliness in the workplace? So Lilia, what's your thoughts there?
Yeah, I think that's a really great question. I think one of the first things that needs to happen is normalize the need for at least food security from that realm, normalize it. I think a lot of people have shame behind asking for some of these resources. And so maybe just even in your workplace, just like putting it up often for whoever needs it, and newsletters. I think, Terry, you mentioned that earlier. That would be like a really great step for people. And then maybe that way employees might feel more comfortable asking for some of these resources. So again, putting those flyers for Hunger Free like around, I think that would be a really great start.
Great, thanks. And then Mandy, did you have any thoughts about that? The first step someone might take?
Yeah, I would definitely recommend taking advantage of the assessment tool that we have available through ABC. However, an immediate action step you could take is finding out if you have a lactation policy at your organization. And if not, that would definitely be the first thing to work on. But it's also important to engage your employees in a conversation and find out what are your barriers, what are things that you're facing. Maybe it's a matter of they don't have manager support and you need to do some training for your managers. So making sure that you're getting feedback and then checking for that policy.
Thank you. And while you're chatting, a question did come in, I think that you might be best to answer, and then we'll pick back up with Michelle on the question. The question that came in is, what are the benefits to being designated as a breastfeeding site aside from the employee appreciation?
Sorry, I was just looking for the question. I looked in the QA and says the chat. What are the benefits to being designated as a breastfeeding friendly site? Yeah, I mean, definitely a lot of positive outcomes to being breastfeeding friendly. Having that certification in place can be a really great recruitment tool and also help to retain employees by having that support in place and making sure that you're abiding by the law. You're definitely going to have happier and healthier employees. Good question.
Okay, thanks. And Michelle, do you want to speak about the first step someone might take?
Sure, yeah, and I'll incorporate or elaborate a little more on both what Lilia and Mandy mentioned. Lilia was talking about normalizing, people's needs and acknowledging that there are needs, getting the word out. We have we do weekly employer updates to anybody in our network with all of the resources that that employees could need, and that includes SNAP and other support for food and rent and all of the 211 options and all of that. We make it easy so the employer can cut and paste and then get that out to their staff in an email. And also with regards to what Mandy was saying about an assessment tool, we have the breastfeeding friendly assessment tool. I would also recommend an organizational assessment, and there is a fee for many of those, but as I mentioned, we can cover that fee for employers. There's Healthings has both a general organizational assessment tool, and then they are also the home of the family friendly assessment tool now too. And so we're happy to help people navigate that and cover that cost.
Great, thanks, Michelle. It's awesome to introduce a resource and also a way to pay for that resource. So that's a double win, I think. Great, Nicole, do you have thoughts about the first steps?
Yeah, I mean, I think a lot of people mentioned, normalizing this in your culture and really thinking about ways that your policies and procedures can be reviewed in a way to make sure that it supports working families. I think what we know right now is a lot of employees hear their employers saying, oh, we're totally flexible, you can work remotely, but a lot of them are still really concerned about the impacts that them having to take more time to support their children at home, for example, is going to have on perhaps their performance reviews. And so as an employer, really taking the time to talk through those things with employees, making sure that this is a message that is very consistent across the board with all managers, because we know that the individual managers actually have the largest impact on individual employees when it comes to them feeling like they either can or can't take these take advantage of these flexibility components, like perhaps companies want them to. So a lot, retraining and making sure that that culture really is established from, the very highest levels of leadership all the way through any managers and employees within the organization, and making sure that those kind of elephants in the room, so to speak, with employees around, well, they say I can, take an hour off in the afternoon to help with my kids' Zoom, but if they chat me during that time and I'm not available, is that going to be perceived as negative? And will that impact, my compensation or perhaps my ability to keep my job down the road? So just being really clear about those things is going to be very helpful for working families.
Great, thank you. And Kelly, how about first steps around supporting maternal mental health?
Yes, like most everyone said, I think organizational culture is so important. And when it comes to mental health, it can be really a tough topic to bring up and talk about in the workplace, as it is everywhere. So I think the materials that I displayed that are specific to parental mental health can really help start those conversations. I think having them materials such as that prominently displayed in the organization right now with people working from home, making sure that those kinds of things are in your newsletters, and also that depending on your structure, that managers are taking the time to talk one-on-one when they check in with their employees, to check in about their overall mental health and well-being, and being extra vigilant about checking in when you know that the family is expecting, either through pregnancy or adoption, or if they've just had a new baby, being sure to check in on that. And then all of the things that we've talked about in terms of not only talking about mental health, but really encouraging and creating a culture that encourages parents to utilize the benefits that are available to them, whether that be sick leave right now. In the future, we're excited to be able to have paid family leave for all, but still it takes the company showing that their organizational supports the utilization of that benefit for it to truly be beneficial for families.
Great, and thank you, Kelly. That was a great segue into the other question that I see in the question and answer. And Deborah, I think you might be best suited to answer this one. It says, how does Colorado's new paid family leave law passed on the ballot this month impact this conversation? And when can we expect more details on implementation? I know that Good Business Colorado's got some great ideas on how to talk about this. So I'll hand it over to you.
Thanks, Terry, and thanks, Emily, for that question. So yeah, it's a really, for Good Business Colorado and our members, it's really exciting that paid family and medical leave is going to become a reality for a lot of businesses that had a really hard time accessing it just because of the cost of self-insuring or the current private market plans available. So the great thing about having a policy in place that everybody is participating in is it levels the playing field. So previously FMLA, which most people are familiar with, but don't always know that that's unpaid leave and that it only applies to businesses with 50 or more employees. And so while businesses with less than 10 employees won't actually pay the premiums for their employees to be covered through this new paid family and medical leave state insurance program, all employees will get covered and in the private sector, and Sole proprietors, which we know is a huge proportion of our entrepreneurial community and businesses, have the ability to opt into the program when it's really particularly hard for sole proprietors to get insurance coverage in the private market currently. So now that the proposition is passed, we're gonna start working on rules and regulations to stand up the program. Premiums will begin being collected in 2023, and then in 2024, the benefit will become available to everybody, regardless if you're working for a large corporation with hundreds of employees or a small moms and pops with just 10 employees. And again, for businesses with less than 10 employees, they actually don't have to pay that premium for their employees, and their employees are still covered, but they have the ability to pay that premium. And I think what you're going to see is as the current insurers prepare for the state program to come online, is you're going to see more compatible programs that cover caregiving, which isn't really widely available in a lot of private insurance policies, become more common. So even in this period, as we're preparing and waiting for the state program to take effect, I think you're going to see some changes in the availability of products on the private market for businesses that have been previously unable to provide the benefit to their employees.
Thank you so much, Deborah. Well, we're at the time of our hour together is drawing to an end. I wanted to first and foremost thank so many of our sponsors, including Good Business Colorado, the Alliance Center, Best for Colorado, the Center for Community Wealth Building, Colorado's Black Chamber of Commerce, Colorado's Women's Chamber of Commerce, the Commons on Champa, Executives Partnering to Invest in Children, the Latino Chamber of Commerce of Pueblo, and Longmont Sustainable Business Program. Today's event wouldn't have been possible without your sponsorship, so appreciate that. And we're really interested in getting your feedback as an attendee. So I think we're gonna create a link into the chat for you to either take the survey right now and just let us know if this is content that's relevant to your business and what kind of content you'd like to look for in the future. And then if you're not able to do that right now, we will be providing a post-event email that includes the recording from today, the slide decks that were presented, if you wanted to share those with a colleague that maybe wasn't able to make it today, and also that survey link. So a big round of applause. Thank you so much to our panelists. Really fantastic resources. I love that so many of them are easily accessible right now. And you've made it very easy for businesses to start to create family-friendly workplaces. So thank you, everyone, and enjoy the rest of your Thursday as you lead into your weekend, if you have a traditional weekend, or the holiday next week, if that's something that's important to you and your family as well. Take care. I can see Deborah working hard to get the link in the chat. If it doesn't happen again, please fill out the survey link that comes with the email from Eventbrite. Great. And Deborah, anything else you wanted to say before we close? Oh, you're muted. Sorry. I'm making you do two things at once.
Thanks, everybody. Really posting that link for survey responses. As Terry said, we are really on a mission to support the values-driven business community. And so your feedback on this event, as well as what you would like to see in future programming, is so incredibly helpful to us. So here you go again. That link. Thank you.
Yeah. Hi, everyone.